Hello, Durhane Wong-Rieger, Chair of Rare Diseases International, and welcome to our second session from our conference here in Dubai. We're going to be focusing now on the future opportunities for rare diseases in Africa and beyond. Those of you who were with us earlier will know that we've got 5 of our panelists that are coming back, and then we've added on 3 additional guests. So just to repeat, we've got Rana Saifi, who is the Regional Manager, Eastern Mediterranean for World Federation of Hemophilia. We've got Roselyn, Kanja, and Christine Mutina, who are co-founders of Rare Disorders Kenya. Samuel Wiafe, who's the Executive Director for Rare Disease Ghana Initiative, and Kelly Duplessis from Rare Diseases South Africa. We also are adding onto the panel Carmencita Padilla, who's the Chair of the Philippine Society for Orphan Disorders, Roberta Anido de Pena, who's the president of the Argentinian Federation of Rare Diseases, and also Lara, who is president and CEO of the Ehlers-Danlos Society. Welcome to all of you. And I think this is going to be an amazing conversation to really talk about some of the challenges and opportunities that are taking place within your locales, but quite importantly, we're going to bring in the United Nations declarations on rare disorders and also how you've been able to help support it, what you're anticipating you're going to be able to expand in terms of your work with it, and how also you feel that you're going to be able to contribute to the work that is outlined in the UN declaration. So let me start with our new panelists that we've included here, and maybe I'll go immediately to you, Carmen. Maybe you can tell us a little bit about, what is your role within the society, and what was your motivation? Why did you get involved in terms of doing what you're doing there?
I'm a clinical geneticist, and I've been working with patients with rare diseases for decades. And finally, we had to get together with professionals and parents to set up the Philippine Society for Orphan Disorders. My specific role has been helping them get the legislation in place so that in 2016, we were able to have a law, the Rare Disease Law of 2016, and hopefully this will provide a framework for the care of the patients with rare disorders in the Philippines.
Thank you so much. And your work actually has really had a huge influence right across the whole Asia Pacific region. So thank you. Now pivot over to Roberta, who also is, in fact, she's from Argentina, but also again, the work that you're doing in Argentina has had a huge influence, I think, in the other Latin American countries. So Roberta, your motivation for being involved in rare disorders, and what do you see as, some of the important, work that contribution from the Argentina Federation?
Well, all started 20 years ago when I began the odyssey of reaching a diagnosis for my eldest daughter, who was diagnosed in 2001 with a common variable immunodeficiency, a primary immunodeficiency. So that was the day was beginning all the new path for my life and for my family, because as you know, the impact of rare diseases diagnostic is not so easy to accept and also to adjust to a daily life, because living with a rare diseases as a family, you have to face very difficult challenges and big challenges on a daily basis. That includes all the aspect of the human life, but that's why our work as an umbrella organization, we work with more than 84 members organizations of different rare diseases in my country. We have about 3,600,000 patients in Argentina that needs to have an early diagnosis, an adequate treatment, and a full life. So our mainly work is at national level, but also we maintain, obviously, alliance at regional and international level to enhance not only our work, but also the work of our members.
Wonderful. We'll come back to some of that expanded work because it really has had a huge impact. Lara, you're in a somewhat different position because you are, in fact, the president of the society and not necessarily localized, though you do obviously do local work. Maybe just introduce kind of your motivation for getting involved, and what do you see as the primary issue that would be for the Ehlers-Danlos Society?
Absolutely. I've been working in this space now for about 12 years. And I originally started running the UK organization, EDS UK. And we realized very quickly that working on a national level wasn't breaking down the fragmentation and the silos that we saw in the EDS world. And so in 2015, we launched what is now the global organization, the Ehlers-Danlos Society. And it's been incredible how much more we've been able to achieve in that short space of time since coming together through that global lens than we have done in the decades before. So my motivation originally was as a patient who waited 12 years for my diagnosis. And what we're hoping is, as we're coming together, we can reduce those diagnostic times and make access to management and care more local, consistent, and long-term.
Thank you so much. So I'm going to stick with you three for the moment, and we'll give you a chance maybe to introduce some of the challenges specifically within your region. And Lara, I'm going to ask you to start thinking about sort of, Mediterranean, African region as well, because I know you do a broad scope of work, but really we want to talk a little bit about some of this region. Maybe to you, but also, internationally. I think you work in a lot of different, with a lot of different patient groups in other countries, so beyond Africa as well. But so Carmencita, let me ask you again, what do you see, what were the key challenges that you faced in the Philippines in terms of trying to introduce the legislation? What was the political climate like? What was the healthcare professional climate like? And maybe what kind of alliances you have with the patient community to get moving? Because it's been monumental, the work that you've done in terms of getting in the legislation.
The basic problem in the Philippines is that we are a low and middle income country, which means we have a lot of challenges even getting into the priority of government, the health ministry. So getting into their attention was difficult because we have other problems like pneumonias, diarrheas, and so on. So together with other professionals and the patients, we put together the society and we lobbied together. So the lobby actually was very important with patients and professionals coming together. But the legislation primarily provides a complete framework. And after all this wait, I think finally now we're preparing the roadmap for the next 5 years as hosted by the government. But my bigger challenge right now really is the funding, because it's not enough that we have legislation. I have to make sure that funding is provided by government in collaboration with the private sector. So I'd say it's really competing with priorities of the government as the most critical point in the Philippines.
Certainly, as you say, I mean, it's not even just low and middle income countries, but when you're talking about countries where, in fact, the investment in healthcare may be quite challenging and competing with other priorities, and also then getting the support for rare diseases may be especially daunting. So thank you very much for that. Roberta, over to you. And I mean, Argentina has had a rare disease policy for a long time, but obviously that wasn't a free pass in terms of getting all kinds of government supports, nor was it a free pass in terms of getting all the healthcare professionals there. Tell us a little bit about the environment that you've been working in, and maybe sort of the key things that you've had to do in order to be able to mobilize support for rare diseases in Argentina and, and maybe a bit beyond.
Well, it's not so far what Carmencita Padilla told. We have in Argentina, our work is focused as a local level. We have a national law since 2011, but despite this, many times the law is not enforced as it should be. So unfortunately, sometimes we have to go to court. So we also have a national rare disease program that in fact is not have a good action plan with a really improvement of the reality that face people living with rare diseases. And since last year, we have a list of rare diseases and a registry of people living with rare diseases. This is all new. All these achievements, of course, were in part as a result of our persistent joint work from the Federation with the Ministry of Health. But we know that we have to do a lot of work, and most of the thing we need to do is to improve our resources map, to know where are the specialists, to have more specialized centers care, and not only to advocate our community and our national members, but our greatest achievements is our continued work in public policies, because this is our roadmap, the way that we could achieve a collective goal for all the people living with rare diseases and their families.
Thank you so much. I'm going to come back to both of you because you talk about the legislation that does exist, but obviously the huge challenges that still exist in terms of getting any of that legislation enacted, or as you say, Roberta, into action plans. But Lara, maybe I'll go to you, and I mean, taking a wide scope, and but maybe focusing a bit on terms of low middle income countries. What have you seen, as an international society, has been the kinds of opportunities and challenges, and does, as you said, being an international society, help when we get to local levels in terms of some of these countries where health services for rare diseases is just emerging?
Well, I think the first thing to say is I can say with conviction that nowhere has it perfect. You think in the kind of progressed US, Europe, UK, those in the kind of lower middle income countries always think that's where they should go for that best quality care. And it's not there. It's not there really anywhere. It's better, certainly. But what we're finding is that, and I've said this many times, that the healthcare systems, they're set up for the acute and not the rare and the chronic and the long term. So when people are getting diagnosed, their therapies and the care that they need is not being given for the rest of their lives. It's being given short term in 6 to 8 weeks. And that's just not helpful. And the education and the minutiae behind caring for a rare disease patient and taking in that full multi-systemic picture is really what's missing throughout. And I think that ranges from those countries where they're lucky to even have an expert in their area to get their diagnosis, to them ranging from somewhere like the US, the UK, where they get their diagnosis, but then going back to where they live, there's no one that really understands it. I had an experience this weekend in the UK with private health insurance. You may be able to see I have black eyes behind here at the moment. I had a straightforward procedure to remove some things from my eyes, but with EDS, you don't react to local anesthetic. So just the lack of knowledge and understanding makes something very straightforward into a very traumatic experience for a patient. And it's those kind of things that make the journey and the experiences of treatment and therapies that is seen consistently throughout. And I think the only way to improve that has to come from the real foundations of education and awareness that is still not perfect anywhere.
So perfect. You're saying, the local access, and the local knowledge is still quite, variable depending on, where you are. So let me go then over to you, Rana, because again, you sit in the, in an international spot, but really having focus in terms of Northern Africa, Mediterranean as well. What do you see as maybe some of the particular challenges that are in this very fairly broad region, and maybe connected to, income levels, but maybe connected to other things, because there are some, countries within there that may not be only, dealing with the kind of socioeconomic issues?
I think, what we've seen is that where progress has happened, it has not been linear. So there are ups and downs throughout the journey of trying to make both the diagnosis, the access to treatment, the prioritization of rare bleeding disorders up on the agenda of decision makers. This takes a lot of time. It takes a lot of perseverance. It takes a lot of patience. But it also takes something extremely crucial, which is strong country-level leadership. That is really a make it or break it element. We see it here with the people around the table, Carmencita, Roberta, Lara, leading those efforts. It's those kinds of individuals that have been able to convince decision makers, policy makers, to put rare bleeding disorders up on the agenda, whether it's through legislation, Samuel as well, through treatment, through diagnosis. That is one of the key elements. I cannot stress it enough. When you have a strong leader, things move, but they do not move in a linear fashion. The other thing is governance of the patient organizations, where the patient organizations have been advanced enough to organize and create their own patient group. They need to build a strong institutional foundation with a solid board of directors, sometimes where possible, a solid medical and scientific advisory committee. They need to know the direction of travel. They need to ensure that they have succession plans that make them more effective and resilient. So if the leader leaves tomorrow, the whole thing doesn't collapse. And these are the elements that help them regroup faster post-crisis. And the crisis in a lot of countries we work with are numerous. They can be economic, they can be political, they can be COVID-related, they can be anything. So you need strong leadership, strong organizational foundations. And then I think one other thing that was mentioned already by Lara, and I cannot stress it enough, which is the education, knowledge, and capacity building. I mean, this is really the end all and be all. Education is what helps break taboos, and I'm sure we'll come to the whole question of stigma later. And it is the patients that understand their own issues that can take better care of themselves, but that can also create those support networks for others. And it's those knowledgeable healthcare professionals that can provide that early and accurate diagnosis and timely care. And both working together can be better advocates and better influencers.
Great. Thank you so much, Rana. Well, speaking as you have said in terms of having champions and having those kind of champions on the ground, maybe it's my perfect opportunity to pivot over to Samuel. Samuel, you're a bit like Carmencita in being in a position where you've got, certainly a strong presence in the healthcare community, but also a real passion in terms of the rare diseases and also working very much so, with the patients and families on the ground. So can you sort of maybe help us understand kind of what's been your, kind of a strategy, I guess it may not have been a formed strategy story for getting into, the policy area and into the actual, system practices area. What have you been able to do here? Speaking from your position, somebody who is, both a professional but tied to the patient community.
Yes, it's. Thank you. It's about understanding the need clearly, understanding that the rare disease issues for low middle income countries for policymakers may not just be just a decision to take, but also have to understand as Carmencita rightly said, the other priorities that exist in the country and being able to offer some form of a solution. And that is what we were able to not just say, this is what the family needs, this, but being able to show, bring in all the stakeholders that needs to be on the table. That is being able to bring in the patient, the clinicians, and industry, and get everybody around the same table before approaching the government people and showing them the real test case of what we ought to see in the system. And the other way to understanding the individual needs of each of the stakeholders. And that is something we need to know for clinicians. What do they want? What are their challenges in being able to take care of the rare disease community and being able to find solutions and offering those solutions to the clinicians and helping them make their work pretty easier for policymakers as well. They need the data and so to take the decisions. So being able to mobilize the data which is actionable and meaningful that could help them take the next decisions are some of the strategies that we adopted. So through the trainings and all of them, we're able to bring everybody on the same table to start thinking about how we can resolve the problems. And most important, we made them understand what will happen if we don't work now. We are crying about resources, but it means that we'll be crying more if we don't pass now.
Thank you very much, Sammy. And it's really, I think, reinforcing from several directions, right, what it is that I think, Rana, you've kind of put together in terms of having certainly the strong leadership, but also being able to get together all the stakeholders. So being WFH, I think you have some natural advantages in terms of already having sort of good practice guidelines and having kind of the international community. So let me ask, really going back to, Roselyn and maybe Christine as well, so you both start as parents, with real passion and seeing the need for getting access to diagnosis and getting access to specialists. Have you been able to, and do you see that as an important channel in terms of finding other stakeholders, including the professionals, including policymakers who can help you make the case in order to be able to affect change? Maybe, I don't know, Christine or Roselyn, you want to take that on in terms of what you see as the role in terms of bringing in the other stakeholders, and how do you get them to kind of really be champions for you?
Okay, let me go first. We've seen a difference in terms of, as we've grown as individuals, we've learned to advocate for ourselves, we've learned to advocate for other members, but now we're learning to advocate and look into policies with other stakeholders. So we need to empower our individual members to be where we were, so that we can grow as an organization. So the key thing is we cannot do this alone, and we all know passion does run out at some point. So we have to have structures and policies in place to make sure that even for our children's children, that there is a difference. Roselyn and I were talking about today morning about, is there a difference we are making? Can we see it? But if you look at it retrospectively, yes, and our children's children will actually get to benefit for the fact that there are rare disease conversations happening.
Roselyn, would you agree? I mean, the idea is to kind of get more patients and more advocates and more families speaking up, but also then being able to impact others who can help advance your message and maybe getting into some of the policy changes.
Yes, true. I totally agree with what Christine is saying, but more so, we also bring into the fold the government, because we can't do much without the policy and from top down, like from policies and programs that actually, address the challenges that people living with rare diseases are having, and actually the awareness that the government has that there are people living with rare diseases, and then also the healthcare workers. So we've had the chance to talk with several, and sometimes even when we see something happening maybe in the rare disease, like maybe a major function or a major conference, we're always sending it to them, sending them, oh, there's this, and they can be able to plug in, be able to see that child that probably they've been trying to figure out what's going on, and and it has been a good understanding and give and take, and they do actually see the importance of that when we work together as opposed to the top down and doctors up there and patient organizations a bit lower. So that has helped in bringing everybody to the table to discuss rare diseases as a country for us.
And I know you're planning a Kenya conference coming up shortly. I just thought I'd give you a chance to promote it.
Yes. So the first time this year, we will have for the first time in the country a workshop that will address challenges of rare diseases in the country. We'll talk about the definition, which we did not have as a country, the need for that definition, the need for a registry, and how do we go beyond that. So it's a conversation that we're very excited about, and we want to bring everyone. We will, of course, bring in even the international community. They tell us how they did theirs and what can we borrow and contextualize, in our context.
Great, thank you so much. And this is my perfect opportunity to pivot over to you, Kelly, because I really, find that you started way back. You hosted one of the first international conferences on rare diseases in Africa, and you have been very active in terms of trying to engage all of the other levels. Maybe I'll go to kind of what the heart is here. We've now got a United Nations Declaration on Rare Diseases, recognizes that rare diseases is in fact an important sector, and also recognizes that beyond just the medical and clinical, it is in fact an important issue impacting social, economic, et cetera. Do you feel, and I know you worked very hard in terms of getting support for this declaration, do you feel that having this declaration is going to help you in terms of what you've been able, you're doing, and in terms of trying to get the attention of policymakers, trying to get the attention of the professionals? How can this resolution help you, and what are you going to do with it now?
So there's no doubt that this sort of legislation, for lack of a better word, is a big stick in which you can use to actually leverage at government level. Unfortunately, Africans have a way of doing things the African way. So we still have a lot of work to do as the African continent in terms of the African Union, but having the United Nations Declaration really, really gives us some form of guideline, and it gives us a top-down approach that we can use to leverage and to create change. But unfortunately, we still have to do a lot of work from the bottom up. But I think also, other than giving us the leverage, it gives us, from our own institutional perspectives, it gives us guidelines in terms of what we really should be advocating and fighting for within our own particular countries and regions. And I think for many of us who have landed in the situation, and we've heard it here in this panel, you come into the situation based on personal circumstances. It's not like we all, decided that this is what we wanted to do for a career. We've landed up doing it out of personal situations and passion. And so we're not necessarily always the most knowledgeable in terms of the best way to advocate or the best way to change policy. So having these sorts of declarations and being given the opportunity as a collective to work towards these sorts of declarations really helps us strengthen our own expertise in terms of what we should be focusing on and how we should do it, which I think is equally as valuable as having that big leverage stick.
Brilliant. So really it's there, and it's there for you to leverage it, and it provides you with the opportunity to get the attention for it, but it's still the work from the bottom up, but also learning from others. So if you don't mind, Roberta, I'm going to kind of come to you with somewhat the same thing. As you said, Argentina was one of the first countries in Latin America and maybe around the world to actually pass a law on rare diseases. But as you said, 2011, it's now 10, 11 years later, we now have a UN Declaration on Rare Diseases. Is this going to be a help to you? And how do you see, that you might be able to use it in terms of advancing the access to better care and treatment for patients with rare diseases in Argentina and in the region?
It's really very difficult for us because the law is mostly 10 years, and sometimes it doesn't happen anything because nobody respects the law for different reasons. And we have a very huge country. We have a very fragmentation health system, so it is very difficult to reach and get in all the areas, as Lara mentioned before, to have an early diagnosis and to have a specialist and a good center care. But I think that all that we are doing with your help, with RDI and all the groups in regional and international helps us to have a transparent work, to try to get the good practices, to have the transfer, the capacity of different organizations around the world that brings up the right tools to work together with the Minister of Health. It's a hard work, but it's the most important goal that as Argentine Federation we have, and also we are in some way an inspiration for other rare diseases and groups in Latin America. You have to have a very good group, as different persons here in the panel says, a great team. Also work with very closely with the professional, the medical societies. And I think that all together working, and also I think that we need also that the general population understands what the resolution, UN resolution has been adopted, because I think it's something very important that they know the importance of all these concepts that were approved in the resolution, because they will allow to work together, obviously prioritizing the concrete action in the middle and long term also, And I think that is something very important for all the umbrellas organizations in our case for the Latin American countries, that we have a great talent is to work all together with the individual organizations to try to find the common objectives, to try to present ourselves to the decisions makers as an allied community, a constructive and a solid community to try to collaborate, but that all the consolidations of the actions plans really improve the reality of the people living with their families, with rare diseases and their families. I think that is a great and big and difficult challenge, but I think that working all together is going to be possible.
It's amazing what you're saying, Roberta. I mean, Fedopov has a huge reputation, obviously, in terms of being a regional leader. But it sounds like what you're saying also is that being able to raise up other countries and other associations also contributes to the work that you're doing. So it creates that kind of regional movement there, which is maybe a perfect opportunity to go to you, Carmencita, because I know that I've seen you in many, of the other conferences, and I know that you are, seen as a real role model across the other Southeast Asian countries in terms of the work that you're doing, certainly specifically around, the genetics, the newborn screening, et cetera, but also in terms of advancing rare diseases. What's it like for you, and how valuable has it been to be able to have other professionals or other policymakers within that Asia Pacific region or in the Southeast Asian region in terms of working collaboratively? Have you seen changes? How's it actually advanced?
Well, I always use experiences from other countries to show my government that we're behind. So I like meetings like this to show them that there are things that they can do better. The UN resolution has been a very important document for me. I just met all the medical societies in the Philippines, bringing them together to come up with the registry for those to be funded. So that was my primary document that I used for that particular meeting. My next set of meetings will be for the other government agencies to come on board. So in addition to the legislation now, I have the UN, I have the resolution now to say that we're not alone. It's a whole world around us telling us that this is the right thing to do. It's very challenging. I think I share all the sentiments of the people in the panel that legislation is one, getting it implemented is another. It's really teamwork. I'm lucky I'm with the university. I have a team of geneticists working with me, but at the same time, I have parents joining me. So I'd like to give a big role to the parents who have been beside me in lobbying for many things. But definitely the UN resolution has been a big boost to me. And as I said, I had just a meeting and everybody says, yes, it's time for us to work on this one together.
So it gives great legitimacy to what you're saying and also the breadth of what you're doing. Tell me a little bit about your collaborations, across the Southeast Asian region, though, because I know you do a lot as well with other geneticists and other providers.
Yes. So we do have a network of geneticists in the region. And being clinical geneticists, we basically deal with the same kind of patients. We have a network of clinicians also and geneticists working on newborn screening. So together, we actually share good experiences and challenges, and we sort of like support each other. We bring around the conference. We take turns every 2 to 3 years. And we make sure that our government is present in these conferences. So sharing experiences across the region actually is very powerful. And we have committed ourselves to making this happen for our part of the world. Because to be alone, in your country is very difficult. But when you're part of a network in the region, that's going to be powerful. And being part of an international network is even more useful and powerful for me back in the Philippines. So I really thank this network and RDI and Durhane, because this has been very useful for me as the lobbyist back home in the Philippines. So thank you to the organization.
You're very modest in terms of what your leadership role is. I'm trying to make, you kind of take a little bit more credit for what you do, but you always kind of push it into everybody else. So kudos to everything that you're doing. We're almost going to be out of time, and I want to give everybody a chance to really talk about what else that you would expect. What can we do at the international community level? Now that you've raised it, Carmencita, how can we help, better? And that might also include, the international patient organizations as well. How can we do a better job to help support the efforts at the national level, at your local level, with the UN resolution or declaration or any other things that we might do? And maybe, I'll go back over to you, Samuel. You are really, not only, as you say, with rare disease, the Ghana initiative, but that was the most recent in terms of hosting, an African summit. Are there some very specific, if you had one wish for what you think the international community could or should be doing to help you in your efforts, what would you ask for?
Thank you. I would wish for improvement on access to everything for rare diseases. Many patients in developing countries and low middle income countries do not have the same opportunity. Organizations in low middle income countries do not have the same opportunity as others in developed countries. Funding grants are usually not accessible, and the patients are not getting diagnosis, they are not getting treatment, and many of the information available are not translated or converted into consumable information for patients in many low-income countries. So I'm actually pushing for an improvement in access.
I appreciate very much what you're saying is that, from an international level, focusing on equity of access, and that may be access for everything. And we also appreciate how much you're doing to actually contribute to that effort. So thank you very much. Laura, do you mind if I go to you? I mean, you have, as you said, now setting up Ehlers-Danlos Society as an international initiative. But what from the international community, from the rare disease international community, broader that, how can we help what you're doing in terms of trying to advance EDS, but, in your work, and especially, in addressing low middle income countries?
I think consistency in the message of what I said earlier, that those therapies need to be offered for life. It needs to come out of that short-term thinking, but also really putting forth the message that it needs to be both physical therapies and those therapies for mental health. Because coming to terms and living with a rare disease is a lot to deal with, and there's often no cure, there's often no treatments at all. And to deal with that and learn how to live with that for the rest of your life, that mental health offering is just rarely given at the point of diagnosis. So helping make that a consistent message across the world, no matter where you're living, it would be great to get to a point where geography and wealth don't determine your quality of life and access to diagnosis.
That is so brilliant. And certainly, I think, as a rare disease international community, we have not actually paid as much attention, as you say, to the mental health and the mental health needs and bolstering those, but also, as you say, the sustainability and whatever initiatives are in place. So thank you very much for that. And like Samuel, I know you're doing a great deal to contribute to that. So maybe I'll follow in that line and go to you, Rana. WFH we see it as one of our leaders. So we look to you guys for actually being the pioneers in terms of putting together programs. But is there anything we could do from the global rare disease community that would also be most supportive of WFH work, and especially in terms of low and middle income countries?
Thank you, Durhane. When I look at the resolution, I see three key points there. One is about strengthening health systems and national programs. These are paragraphs 1, 7, and 8. And then I look at the paragraph 3, which talks about the stigma and taboo. And then I look at paragraphs 5 and 6, which essentially talk about data collection. So three key issues, national programs, stigma and taboos, and data collection. Now, how does WFH deal with some of those? Our vision is about treatment for all, tackling issues that you've all raised about inequities, about lack of access to treatment, and so on. And the way we do it is that we have a comprehensive development model that has 6 interrelated pillars that go from government support through care delivery, through increasing medical expertise, through lobbying, advocating for better treatment products, through capacity building to build the patient organizations, all the way to data collection. So my sort of view on the best way forward is to keep looking at the resolution, as Kelly said, as the key framework that guides the work of the different people on the ground, to do what Christine and Roselyn said, to keep looking for those allies, basically to keep talking as a one united voice for the patient groups and the healthcare professionals to work hand in glove. This is the very only way. There is no other way. Advocating in one voice. If that voice is broken, then the listening ear is lost, essentially. And then to focus strongly on data collection, to build the evidence to show policymakers how health outcomes can be improved, how the quality of life for persons with rare disorders can be changed, not just from a physical point of view, but what Lara said also from a social, psychosocial point of view as well, and taking all that forward as a package. Capitalizing on the networks, international, regional, local, not missing a single opportunity, doing it all. It takes a lot of effort, but it works.
Thank you. I'm going to just say we're totally out of time, but I'm going to give maybe an opportunity for Kelly and then for Roselyn and Christine also to come back with one thing that you would want from the international rare disease community. Kelly.
I think just awareness of healthcare literacy and an understanding that first world countries often do things in a much more advanced mannerism, which makes it quite difficult for us on the ground as advocates in relatively nascent settings to have a firm understanding. So I think if we could all be cognizant of the language, the type of language that's used, and making material a little bit more adaptable to grassroots levels, I think would be great.
And this is really why it's so important to have people working at the grassroots levels to be able to be that intermediary in translation. So I'm going to go to Christina and Roselyn. Either one of you can go first. You get one wish out of this. And you don't have to share the wish, but you get a wish.
We get to. Awesome. For me, it's capacity building in the sense that we are young in this rare disease patient advocacy group journey. And it should be best if we had not reinvent the wheel, basically. So have somebody show us this is where we're supposed to do, show our government this is where we are headed, this is how the future looks like. Because as individuals, you cannot go very far, but together we'll go very far.
Thank you so much. And that is really something that we are trying to, I think, do better. Roselyn, to you.
For me, it's a bit of what also Christine said, is that to also empower patient groups. So like Christine said, both of us came into this from a different lifestyle and having to advocate and learning what that even means for ourselves. That's something new. And we're still learning, and we wish that could be able to help even others, like just help us understand what it means to just advocate and do all this for others.
That's brilliant. And what we've all, I think, recognized from this is that, as you say, we can't just do it from the top. And having all the legislation and all the national and international, declarations and programs there, they are meaningless unless there are leaders and there are people on the ground. But what you're also saying is that if you're going to do that, listen to the people on the ground, empower the people on the ground, because it actually does work differently there. The language is different there. The understanding is different there. So this has been a tremendously valuable kind of encounter. I can't thank you folks enough for coming and sharing your expertise, sharing your experience, but also really, providing the kind of recommendations that we need as an international community. And most of all, though, sharing your commitment to work together. Thank you so much. This couldn't have been a more brilliant discussion. Really, really appreciate it. And certainly, I think we all appreciate the work that you're doing. So thank you again.